Medication Administration Training Program. Giving Oral Medication, Part 2.
Now let's talk about giving liquid medication. Please follow along with these 3 handouts. Procedure guide for measuring and giving liquid medication by cup, by spoon, and by oral syringe. When measuring a liquid medication, always use the measuring tool that comes with the medication or the one provided by the parent. This may be a medication cup, a dosing spoon, a dropper, or an oral syringe. Make sure it's labeled with the child's first and last names. The measurement marks on the tool must match the dose measurements on the consent form. So if the consent form calls for a dose of 2 teaspoons, then the measuring tool must be marked in teaspoons. And never use household items such as a kitchen spoon to measure medications.
Giving medication using a medication cup or dosing spoon.
First, identify the measurement mark for the dose you will be giving on the medicine cup or dosing spoon. You may want to mark the correct dose with a pen or marker. Be sure to mark next to the measurement line, not over it. Check the medication container, and if it says to shake the medicine, then do so. Pour the medication into the medication cup or spoon until it is level with the measurement mark for the dose you will be giving. If you're using a medicine cup, put the cup on a flat surface and check the accuracy of the dose at eye level. If you're using a dosing spoon, wipe off any excess medication that may be on the lip of the dosing spoon and check the accuracy of the dose by holding the spoon at eye level. If you put too much liquid into the medicine cup or spoon, as long as the cup or spoon is clean, you can pour the excess back into the bottle. Just before giving the medication, match the 5 rights. This includes checking the accuracy of the dose at eye level, even if you have done it before. Then give the child the medication cup or spoon if they are old enough, or help them drink the medication if they are younger. After giving the child the medication, put a little water into the cup or spoon to collect any leftover medication. Have the child drink this.
Giving medication using an oral syringe.
Now, let's learn about using an oral syringe. Please follow along on the procedure guides for measuring and giving liquid medication by oral syringe. Shake the medicine if indicated. Identify the desired dose measurement on the syringe. Make sure the plunger is pushed all the way down into the syringe. If the medication bottle has an adapter, put the syringe in the adapter. If the bottle doesn't have an adapter, pour a small amount of the medication into a clean disposable cup. Put the tip of the syringe into the liquid and pull up on the plunger to draw up the medication to the line indicating the correct dose. To check the dose for accuracy, hold the syringe pointed upward at eye level. The top of the plunger must be level with the line on the syringe that marks the right dose. The syringe tip must be full of medication, and there must not be any air bubbles in the medication for the dose to be correct. If you need to remove air bubbles, with the syringe tip pointed up, tap the syringe to move the air bubbles to the top. If this doesn't work, pull the plunger down until the medicine is below the bubble, then return the plunger to the correct position. Just before giving the medication, match the 5 rights. Give the medication by placing the tool in the side of the child's mouth between the gum and cheek. Do not squirt more medication than the child can swallow at one time. Never aim the medication directly down the throat. This may cause the child to choke.